A very good morning, good afternoon, and good evening to all the people joining for this webinar. First of all, welcome. My name is Shrija, and I will be the host for today's webinar. So this is our 8th chapter of eGov Academy Learning Series. And as you may know, that today's topic is slightly different from the previous one if you have already attended the previous ones. Because today we will do a deep dive on one of the amazing products that eGov offers. This product, which is currently being used in 7+ countries, what they do is to streamline their health campaigns and make sure that the service reaches everyone and that no one is left behind. So in today's session, we will take a closer look at Digit HCM and how it powers every stage of health campaigns, right from planning, beneficiary tracking to field operations, supervisions, complaints, and also how do we make data-driven decisions. So, and we will also see how single product is seamlessly connecting all the stakeholders that is part of this entire campaign management, from health officials to frontline workers to program managers, everyone. So without further delay, let's meet our presenters today. We have Roshan, Joshi, and Akhil Siddharth with us today. So Roshan has been working as a business analyst in eGov for over 2 years, supporting campaign implementations across Africa and also looking after HCM product. And one of the goals that Roshan has for this year is to be successful. So all the very best, Roshan. As far as Akhil goes, Akhil is part of our product team at eGov. He's currently the product manager for HCM Console that you will see today, which is a non-code platform to run health campaigns. He previously has worked as a consultant with National Health Authority, Ministry of Health and Family Welfare, and Walmart Labs. Before handing it over to Roshan and Akhil, some key pointers that I want to share with all the audience is the presentation will be about 40 to 45 minutes. Remaining 15 to 20 minutes, we will use it for Q&A, insight sharings, and if you have any queries to resolve them. And so you can see Q&A icon on the bottom of the screen. So you can use that and raise your question anytime that you feel like. And feel free to ask questions and engage. So with this, I hand it over to Roshan. Roshan, all yours.
Thank you so much, Rija, for the warm introduction. Hello, everyone. Good morning, good afternoon, and good evening from different parts of the world. So, I'm Roshan Joshi, as Shrija already introduced me. So, I'll be initiating this session and I'll be talking about Digit HCM, what it has to offer, and uh, how it makes the health campaign management easier and optimized, and how we can reuse the data using Digit HCM for different campaigns across the country. And first, I'll walk you through a few slides to talk about Digit HCM, and then we'll try to spend more time on the live demo to show how the features look like in actual. So introducing Digit HCM, before we go into HCM, just for everyone's understanding, so what is health campaign? Health campaigns are basically time-bound activities that are done within the country, depending on the infrastructure and the outbreak of a disease, so that the interventions can be provided and maximum coverage can be achieved within that particular span of time. Now, health campaigns have different activities. There are different phases of a health campaign, starting from planning. So we have micro planning phase, where you need to plan for the beneficiary population, the target, the interventions required to serve those populations, as well as the facilities where these commodities will be stored during the campaign. And as we complete the planning phase, then we have the implementation phase where we need to decide how many personnels would be required, what are the tools that will be used, be it a paper-based campaign or where we have digital tools to support these health campaigns, HCM being one of the part of it. We have registration and distribution activities that happen on the field, where we have the program team who help understand how these campaigns would work, starting from registration delivery till the supervision and monitoring. So what we have done is we have split campaign digitalization into three different parts. One is the program, the second one is product, and the third one is people, who are no one but the beneficiaries, who serve for these particular campaigns. So product, as we were talking about HCM, so HCM stands for Health Campaign Management. We'll be talking in further details about what it has to offer. Programs are basically the countries who drive these campaigns to serve the beneficiaries and the targeted population. And people are the ones who collaboratively work in order to achieve that outcome. Talking further into details, who all are the actors that are involved for a successful implementation of health campaigns. So we have the Ministry of Health. So across all the countries, most of the countries in the world, we have dedicated personnels from the Ministry of Health to drive these campaigns. Then we have the technology partners who help implement a particular or a digital tool in a country for supporting health campaigns. Then we have campaign implementation partners who help with the logistics, the personals, the commodities that are required within the country to achieve the coverage. And in addition to that, we also have domain experts and other implementation partners who help drive the campaign successfully without any issues and support throughout the campaign whenever and wherever needed. Without spending further time into the the program part of it, I'll quickly dive into the product, which is HCM. So
Roshan, I will just interfere here. Sorry for the interruptions. For our audience, we also have captions you can see in the below strip. So you can actually transcribe all the thing that Roshan is saying in your language. So please go ahead and use it in case you need. So click on captions and you'll be able to choose the language you want to hear this in. Thank you. Over to you, Roshan.
thank you so much, Rija. So in this session today, what we'll talk about HCM product is what all modules does HCM have to offer, how the data flows from these modules to our dashboards, how the reporting and visualizations are done. And then we'll see how admin console comes into picture to support these customizations and configurations that are needed to make the product country specific and to suit the requirements without any technical intervention. So starting with the first activity, which is registration and distribution, how HCM is built for the frontline workers. So frontline workers are usually the campaign health workers or the on-ground workers who are in charge of reaching out to these beneficiaries. They carry out the registration, enumeration tasks on the field and also deliver the necessary interventions. So interventions can be anything depending on the campaign strategies. So, for example, for malaria diseases, we have interventions in the form of bed nets to serve households. We also have SMC medicines for children aged 3 to 59 months to immunize them during malaria outbreaks. Then we have IRS, which is indoor residual spraying, which is done over the houses to make it to prevent the malaria mosquitoes from entering the houses. On the other hand, it can also be the polio interventions that are also given, the different form of vaccinations as well. And in some part of the country, the intervention can also be in the form of awareness, SBCC communications that are conveyed to raise awareness around these diseases and how they can prevent the diseases from happening. So how Digit HCM helps the frontline workers is the registrars or the distributors can use HCM on their mobile phones to register households. They can add more members in the households, which can be reused, like I mentioned. So whatever data is captured in the application can be reused across different campaigns in the subsequent time. And we also have additional features like linking the beneficiaries or a voucher to the beneficiaries or the households, depending on the campaign strategy. They record these data and sync it on a daily basis to ensure the data is flowing in real time and is reflected on the dashboard. So Digit HCM is an offline first application, where you can record the data and carry out the tasks even if you are offline. If the the geography doesn't have sufficient infrastructure to support stable internet, so it completely works offline. But if in case you are working in an online situation, it will automatically sync the data at regular intervals. Other than that, they can also raise issues through our complaints module from the mobile application, which directly flows to the dedicated help desk team who has the web module interface from where they can track and manage complaints. And they support these door-to-door campaigns and fixed post campaigns, again depending on the how the infrastructure is in order to reach the households. If in case they don't have good roads or proper terrains to navigate to the households, they can set up outreach posts, and the interventions can be served at those posts during the campaign. Now I'll talk about a few features which within HCM which are relevant to the registration and distribution activities, starting with the beneficiary ID generation. So HCM provides an in-app unique ID generation, which is basically server generated. So at the start of the day, what you can do is you can simply log in the mobile application, and while you are at a place where you have internet, you can simply download this unique data all at once. So let's say for a campaign, usually we have a dedicated target for each team. Let's say for a particular day, a team is supposed to reach 70 households. So what we can do is we can define the beneficiary ID count to be 70 or 80, keeping some buffer. So they can download those IDs at the start of the day, and it will get stored in the local devices, whatever they are using. And then they can carry out the registration activity where these unique beneficiary IDs will be tagged to each and every individual that will be registered in HCM. So here you can see some of the snapshots from the application where you download the IDs, you can see what is the available ID count in the device, and you can then see what ID is tagged to the individual, which further can also be used to search the beneficiaries. As you can see here, by typing the ID number, you can simply search for them. Moving forward, we have another capability which we call as an enumeration tool, which is again a part of the enumeration or registration activity, where for community health engagements you can enumerate the beneficiary data. You can take the total count of beneficiaries based on different demographics, like how many children are there under 5 years, how many children are there who are not even vaccinated for once, which we call in health terms as zero dose children. How many pregnant women are there in the households? How many pregnant women are there who are not mothers yet, like who are going to deliver the first child? So all these information, as you can see, can be captured. And I would just like to highlight one more thing here, which I'll keep on mentioning as we do the demo as well, that all the things that you see in the application is highly configurable. So be it the label changes, be it adding a new field or removing a field, changing the validations, keeping something mandatory, or putting some dependency logic based on the field types, all these things can be easily configured in HCM. Some of it we'll definitely see while Akhil will be doing the demo for console. So yeah, so in terms of enumeration, as you can see, you can record the vaccination details of the child while you are enumerating that particular child. And all this information, again, is stored in the application tagged to a particular household as well as the beneficiary. So it also helps establish a mother to child relationship as well in the application, which further can help you to make better planning decisions for any subsequent campaigns within a particular country. So, what values does it have to offer? It helps to maximize coverage, monitor the progress, and ensure the complete data and is stored and efficiently resources can be managed accordingly. Further, we have another capability which we call as assessment-based checklist-based delivery, which again comes into picture for determining and assessing a child or a beneficiary based on the targeted population, whether the beneficiary is eligible for receiving the intervention or not. So we have it in the form of a checklist where you can ask these questions to the beneficiary, or if it is a child, you can ask these questions to the mother or the caretaker to understand if the child is healthy enough to receive any medicine, or if the child needs to be referred to a primary health center or a health facility during the campaigns. So here you can see it's a very simple checklist based flow where there are predefined questions, which is again configurable. and we have the logic based on the responses that is captured. So based on the captured response, the system will itself determine whether the child is eligible for administration or not. Next, we have delivery for community living facilities. So for certain campaigns, just giving an example here, we have an NTD campaign called Sisto, which is again for targeted children who are below 15 years. So usually these campaigns are done at schools or other institutions where you can find the large volume of children for that particular age group. So community living facilities helps reach out to those beneficiaries within the application and record the data. Uh, School being one of the examples, it can also be served for refugee camps and other orphanages and other institutions, fixed institutions to be specific, where you can easily record the details and tag all the beneficiaries that belong to those institutions. Uh, Further, in addition to the community living facilities, we also have something called as transit post delivery, where instead of creating the beneficiary records, where the objective is just to maximize coverage, irrespective of tracking how many beneficiaries were served, transit post comes into picture, where you can simply reach out to any place where you have crowded population and you can identify beneficiaries that require any particular intervention, and you can simply scan the resource and deliver it one after the other. This is particularly for polio and polio immunization campaigns, where again the objective is to vaccinate as many children as possible, so that they are immune enough from the polio diseases. So it helps timely delivery of the interventions and better coverage with reduced friction on the field and high efficiency. Uh, Another thing that HCM does has to offer is integrated campaign strategies. So at times in certain countries, what we have seen is that in order to maximize coverage, what they do is they club different interventions, different medicines all together, and they deliver it to the beneficiaries within the single campaign, which helps save their time and cost at the same time. So what HCM does is it helps configure campaigns with different diseases and different interventions all into a single campaign. This ultimately helps efficiently deliver multiple interventions, like I said, resulting in cost and time savings. So here in the snapshot, you can see, for example, here we are delivering both polio and measles all together at a particular transit post for this particular example, but this can be easily achieved in HCM. Then we also have another feature which helps share the data offline on the field, which we call as peer-to-peer data transfer. Here, what you can simply do is if one of the user has downloaded the data from the server, uh, when I say data, I refer to the beneficiary data that is recorded for a particular country in previous campaigns. So when you download these data in your device, you can then go on the field and share it across different users, even when you are offline. So again, what it helps is it helps reduce the mobile data costs and also the downsync data time, which ultimately drastically reduces, just putting a number here, up to 90%. And this works completely offline. So you need not have internet for sharing this data on the field. So this was all about the features that are relevant for registration and distribution activity. Now I'll move forward to the next phase or a next activity, which is inventory management. So again, in order to deliver interventions, you need to also have a robust supply chain in order to track the commodities for a particular campaign. So inventory management is again used. So warehouse managers can use HCM to track the inventory, record multiple transactions. For example, you can record how many stock has been received from one facility to another, how many stock has been issued, what is the stock that has been returned back, and you can also track if there are any losses or damage in the stock that was transferred from one warehouse to another. So all these transactions can be easily recorded in HCM. And then you can also reconcile what is the available balance based on the transactions that are recorded in your system. So, for example, based on all these transactions, the system determines what should be the available balance. And again, that you can manually reconcile what is the actual balance, and then you can monitor and track where the discrepancy is, if in case there are any differences in the actual stock versus the calculated stock. And we also have in-app reports, tabular reports, where you can review all these stock transactions, which again helps maintain a transparency and ensure accountability of all the stock that has been transferred from one warehouse to another. So just a simple flow that we have here is, so this is how the landing page looks like. So here you can see there are different actions where you can manage the stock, you can reconcile the balances, and you can also see the transactions in view reports. So all these are available here. So in the inventory management flow, we currently have all that you saw and all that I explained right now. Uh, Now moving forward to the supervision and monitoring module, this is relevant for supervisors for a country at who are designated at different levels, starting from the national level. Then we have state or province level supervisors as well, and then we have district level supervisors. We also have field level supervisors who are in charge of monitoring the teams on the field and also take the attendance of the field teams while they are on the field during the campaign. So what this does is it helps maintain a visibility to the national teams on the campaign progress and also the performance of the field teams. And they also maintain a bridge or a connection between the support team, the technical team, and the frontline workers, if in case they are facing any issues on the field while using the applications. They also provide logistic support as well, if in case they don't have enough stock for a particular day. They reach out to the warehouse managers or the relevant support team to ensure that they receive enough stock within the particular time. So how HCM enables the supervisors is, like I mentioned, they can run the supervision operations on the field with the help of checklists. They can also manage whatever is relevant. So, for example, the national supervisors and the provincial supervisors, and as well as the district supervisors, have access to the dashboard for their designated geographies. So they can monitor the campaign performance. They can take real-time decisions based on the insights that are generated on the dashboard. So they can also mark the attendance, like I mentioned, for the field teams. So we have an attendance module as well, where you can scan the badges of the frontline workers in order to mark the attendance. And like I mentioned, to track the data in real time and track the campaign performance. So these are some snapshots from the dashboard, which is built on Digit. Again, we call it as DSS, which is Decision Support System. So I'll show that as well during the demo. So in the app, we have a checklist module for supervision, as you can see here. It's a very simple flow where you can configure checklist for different response types. It supports a huge variety of response types, be it a text input, a drop down, or a radio button, yes, no, multiple choice. All these response types are supported. And we also support nested checklist questionnaires. For example, if there's any dependency from the first question to the next one. So those kind of relationships can also be built on HCM for these checklists. The other thing that is again needed for supervisors is the attendance module. So here you can see how you can mark the attendance on HCM with the help of scanners. So for each user, for each system users, especially the frontline workers, we have a system generated QR code, which again refreshes every time for a configured interval. And you can scan the codes from these user profiles for each and every worker in order to ensure that the users were physically present on the field, and then only you can mark the attendance. Now, we also have a payments module, or to be more specific, we have a payment advice module where, based on the attendance that is taken from the field, the data flows into the payment system where you have a proximity supervisor who reviews these attendance from the field and approves the attendance. After which, all the attendance data is sent to another role, which we call as a payment approver or a payment supervisor, who reviews the attendance again, and they can generate a bill at different levels. So here you can see you can generate a bill which is consolidated at district level or at a state level or even at a national level based on the requirement. So once you generate the bill, it will you can download the bill in the form of Excel or a PDF, which further can be shared to the financial institutions to disperse the payments. So in the existing version, we are doing only till the payment advice flow, where you generate and share the bill that is generated from HCM based on the attendance to the external financial institutions. Moving forward, we have a dedicated help desk, complaint management and help desk module. So complaint management, like I mentioned earlier, in the mobile application, you have a complaints button for all the roles where you can raise any issues that you are facing on the field, which then flows to a help desk. So help desk is basically a central hub where all the complaint flows. And from there, they can take relevant actions based on the level of expertise. They can either resolve the complaint if it falls under their skill sets. They can reject the complaint if it is invalid or if it's a duplicate complaint, or for whatever reasons you can reject the complaint from the application. And you can also assign the complaint to a next level. So usually we have different levels of support based on the technical expertise. So you can assign the complaint to a higher level L2 or L1 support based on the complexity of the issues. So why is it important? It helps manage ground level issues on the campaigns, and it gives a visibility to the supervisors on the level of number of complaints that are being raised, and what is the status, whether these complaints are resolved yet or are still in the pending state, so that they can take relevant actions. And it also helps improve the efficiency and the scale of operations, so that because the team can provide resolution and in a shorter span of time with a shorter SLAs, so it helps give quick resolutions to the team. So what Digit HCM has to offer for complaints is you can easily track the complaints that are filed, and actions are taken easily on those complaints in the help of dashboard. You can file a complaint using the mobile application, as well as the help desk user also has the capability to file a complaint on behalf of the users. You can take relevant actions on the complaint, and all the access is role based in HCM, be it registration, inventory, supervision. You can assign dedicated set of actions to a particular role, which can be easily tagged to a user. So all this is done on HCM. So just a quick snapshot for what help desk has to offer. So here you can see you can file a complaint using the web portal, or you can take action on an existing complaint. So here you can see this is how the inbox view looks like, and you can open a complaint using the complaint number and take relevant actions. In addition to this, the help desk team also supports for in terms of user management during the campaign. So for all the system users, they have an access where they can see all the users that are created for a campaign, and they can take relevant actions like deactivating a user if in case the user has been dropped out from the campaign. They can edit the roles or any other details if necessary using the user management or HRMS portal. And they can also create a new user using this portal. So all this can be easily done on HCM. Quickly moving to the dashboard and reporting section. So how Digit HCM provides a digital headquarter for the health ministry. So you can easily set up and configure different campaigns using console, and you can with the help of the dashboards, you can have a real-time view of the performance of each and every region within the country, and you can identify those which are having very low coverage, and try to avoid any bottlenecks and delays that are encountered within those regions. And you can also define reports based on the requirements. So we also have custom reports, which are Excel-based reports, to have a view of the transactional data from the dashboard. So you can easily export these data in the form of charts or in the form of tabular reports based on the requirement. So in addition to this, what Digit HCM also has to offer is that it is highly interoperable. So you can integrate with other systems. One of the examples is DHIS2, which is again a monitoring system in Africa. So you can easily integrate with DHIS2 systems to to transfer the information, whatever is captured from HCM, into their system for their monitoring and visualizations. Speaking of integrations, we have also done one integration with Congo, which is for payment. So we have integrated with MTN Money, which is a mobile money operator in Congo. So we are doing the end-to-end integrations where the payment advice information flows into their system using HCM, and the payments are dispersed to these workers who are working for the campaign. So, what is the importance of real-time visibility? I think this is very self-explanatory. It helps track essential campaign information. It helps to monitor the progress and take real-time actions. It promotes transparency, accessibility, and helps make improved decisions during the campaign. And these are some of the features that our dashboard has to offer. You can drill down the data till the lowest level, till the village level, to see how each and every village is performing during a campaign. You can have a single source of a unified dashboard interface for multiple campaigns based on the assignment. We have map charts where you can see the coordinates, the geo coordinates that are captured from the application for different transactions. We have a predictive charts where you can see based on the planning what is the expected coverage, what is the expected time during which the campaign should be done. Against that, how we are performing in real world scenario. You can also have a navigate. So we have dedicated tabs in the dashboard for different modules. And these and Just to summarize about all these capabilities, so this is just a quick summary of how these functionalities work and how this can be used for different campaign types. So here you can see registration is something which is used for all the campaigns. Voucher based registration can or cannot be a parameter for certain countries, so this can be configurable. If you want to enable, you can, or you can disable that. Similarly, for other modules as well, you can see whatever can be added, whatever can be configured is all provided here. So this was just a quick overview in the form of presentation about HCM. Uh, Shrija, do we need to take questions now, or should I jump onto the demo?
We can jump onto the demo, but if required, people can also add in their questions on Q&A. So we will take it as and when it comes.
Yeah, so you can post your questions in the Q&A. We'll be addressing that wherever needed. So I'll just quickly switch to the demo part. Allow me to share my screen. Yeah. So what I've done is I've already logged in as a frontline worker in the mobile application. So this is how the landing page looks like for a frontline worker or a distributor. So you can see there are different cards for different actions. On the top, you can see the assigned boundary wherever this user is assigned. And we have a progress bar, which I mentioned during the presentation, that each and every team has a dedicated target. So here the number is quite large, but this is again configurable based on the real world scenarios. And we also have a user profile which can be accessible throughout the flow across the screens in the application. And from here, you can open the QR codes for scanning for attendance and other activities as well. And you can also notice that currently we have configured three languages: English, Portuguese, and French. But if in case you want to add more languages, that can also be easily done during the implementation. So you can add new languages based on the region or the geography where you are operating in, and you can use the application as is. So I'll quickly start with the beneficiary ID part. So we have an in-app validation where you cannot proceed with the registration unless you have the IDs enabled. So I'll download these IDs. So I've already downloaded, so you can see the count has been updated accordingly. Since I had already used a couple of IDs today, so it is showing me the balance that is 98. Now I'll go to the beneficiaries flow. So here you can see there are certain permissions that you need to provide. So in order to capture the geolocation, you need to enable the location services within the application. And on the search screen, you can see there are multiple parameters using which you can search a particular beneficiary. You can search by proximity for all the households that are registered in the defined radius. You can search by unique ID, which I talked about in the demo. And primarily, you can enter a name to search for a household. So let's say there is a household head whose name is Jacob. So when I attempted to search for Jacob, it says there are no match found for this name. You need to register a new household. So I'll click on register. Now on the location screen, it automatically captures the geo coordinate for this particular household. And you can see some other information that can also be captured here: house number, administrative area, postal code, landmark, etc. So currently these are non-mandatory, so I can just skip and proceed. But if you want to change the validations for these fields, you can easily do that. You can make it mandatory. You can put some regex validations if needed. So all that can also be done. So moving to the next screen. So again, within HCM, you'll come across certain screen in the flow which is not relevant for any particular campaign type during a particular implementation. So this screen is one of the examples for it. So this information is not relevant for campaigns like BedNet or SMC. This is more relevant for IRS campaign, where you need to identify the structure of the house in order to determine whether it is suitable for spraying or not. So this is again a configurable parameter where you can simply remove the screen from the flow during implementation, where if you are implementing for an SMC campaign, you can simply skip this from the flow. But now in order to proceed, I'll just take some information and proceed. Now, this is where you can see some of the details are captured for different beneficiary types. So starting with how many pregnant women are there, I'll enter some details. How many children below 5 years are living in the household? And in addition to that, how many children under 15 years are living? All these information are captured here. And since these are mandatory, I'll have to capture these information in order to proceed. Now on the individual detail screen, we capture the details for each and every beneficiary, and you can see the name is auto-populated from the search screen. So I can still go ahead and make some changes. So let's say I want to change this name from Jacob to Steve. So I'll just put Steve here, and I'll
Roshan, there
select.
is one issue that people are saying that they're unable to see the demo screen.
Okay, let me share it again.
Is it with everyone? Can you give me a reaction to this? Is everyone facing the same issue?
Let me reshare it once again.
Yeah. So was it there since beginning when Roshan started sharing the demo, or is it now? Okay, there is one question. Let me open that up.
Okay, I hope it's visible now to everyone.
Can you give me a thumbs up if it is visible to everyone? Oh, okay.
All right, thanks.
Thanks. Thank you, everyone.
So I'll just quickly go back and show you how it looks like. I'll not elaborate it again, but yeah, like this is how the flow looks like. You start from the search screen, you enter the name, and then you can see the register button gets enabled as soon as you attempt for a search. Then the location is captured on the screen, and you can add more details if needed. And you can, if not needed, you can simply remove these fields while configuring, and you can change the validations as well. Now this screen is not relevant, so I'll just proceed without putting any information. And here you can capture the details for different demographics, how many children, how many children aged 5 years or below, how many children aged 15 years or below, how many women aged 15 to 49 years are in the household. So all this information is captured here. And you'll also notice the date field is auto-populated and this is disabled. So the system is automatically capturing today's date and it's not allowing me to change the date. So we are restricting backdated entries, especially for enumeration here. But again, this is a configurable parameter. If you want to enable it and allow it, that can also be done. Now here the name is auto-populated. I'll keep it as is. And in the next field, just to highlight, you can see below the name, there is a checkbox which says head of household and the action is disabled. So what this signifies is this person who is being registered is marked as the head of the household. So usually in health campaigns, what we have noticed is households are usually identified by the head of household's name. So that is why whenever you are registering the household for the first time, the first individual who will be registered will be automatically marked as the household head. So which means what this means is Jacob is the household head and we are registering the first individual who is the household head. Now moving forward, here in the drop down, I'll select the unique beneficiary ID and you notice the ID number field got disabled. So this dependency logic is again a parameter where you can define that based on the selected option from the drop down, what field should be disabled and what should be auto-populated. Now I'll enter the age here. I'll select the gender and the other fields are non-mandatory, but I can still go ahead and put some details. And you can see there is a validation for maximum character limit. So I cannot enter more than 10 digits. So this is again configurable for countries where there are 11 digits or 9 digits. Let's say you can change those validations as well. And we also have this voucher linking capability. So I'll just quickly open the screen and show how you can use the voucher scanning. Just give me a minute. So I'm just scanning a voucher right now. I'll just quickly go back to the screen. So here you can see I've scanned a voucher and the voucher code is displayed on the bottom. Now, when I submit, the voucher code is displayed on the individual detail screen. I can still go ahead and change if in case I've scanned some wrong code, but or else I can just submit. So we have a summary screen where you can review the details of all the information that is being captured, and then I'll submit again. Now you can see on the success screen, it is showing me the beneficiary ID that is tagged to this particular individual. Now I'll quickly go back and show you how this household details page looks like. And here you can see we have edit options for household level details as well as individual level details. And the ID that was tagged is also displayed here. Now what you can do is you can add a child under Jacob, or you can add another member and add another children under that particular member as well. So let's say there is an individual named Maria. I'll again select ID type as unique beneficiary ID. I'll put the age as 25 years and I'll skip the other information since those are non-mandatory. So now these two individuals are added and you can see the status is shown as not eligible. The reason being on the eligibility parameters that are defined for this campaign. So I have logged in for an SMC campaign where the eligible age group is 3 to 59 months. So now I'll show you how that will look like. So let's say there is a child whose name is Steve, and I'll put the age as 2 years, which is 24 months. And you can see here for every children, we have some information in the form of checklist that also needs to be captured. So this is again for a routine immunization campaigns for community health workers where they need to identify if any child is a zero dose case where they need to vaccinate the child for the first time. So let's say I'll say the child has a card and I can configure the vaccines that are being provided to this child. And now I'll submit. Now here you can see the count has been increased. I'll open this. And here you can see the status is changed. Instead of not eligible, it says not visited. You can again relabel it based on the requirement. You can put it as not vaccinated, not administered, whatever. And here you can see there are delivery actions which are enabled. So when I click on deliver intervention, so this is where the assessment checklist comes into picture, where you will have to give a response based on the questions that are asked for this particular child. So is the child sick? I'll say no. Has the child shown any side effects for SPAQ? So SPAQ is the medicine which is given during an SMC campaign. So I'll say no. And for the third point as well, I'll say no. So now, based on the defined logic, ideally, if the child is not sick or if the child is not showing any symptoms after the medicine is given, the child should be eligible. So here you can see in the pop-up, it says the child is eligible for administration. Are you sure you want to proceed? So I'll click on proceed here. And here you can see we have the beneficiary details screen where you can see the details of this child and what is the status of the current cycle. So based on the campaign duration that is configured, it will show you in which cycle you are. So here you can see it says you are in cycle 3 right now. And if I go and change the system date to some previous cycle duration, it will change the cycle date accordingly. So here I'll click on record. And here in app, we show what is the resource that needs to be given for a particular child. So this is applicable for different campaigns. Even for BedNet, we can show based on the total number of members, how many BedNets needs to be given to these households. All this thing can be shown in the system to inform the distributors. So here it says for this child, the dose that needs to be given is 1 SP and 1 AQ. I'll click on proceed. And on the delivery screen, you record how many doses were given for each medicine. So there are cases where the child vomits it out. So we also need to give more than one medicines for re-administrations as well. Hence, we have kept this field as an editable option. We have a delivery comment, which is a non-mandatory field, but I'll click on select a drop from the drop down. And here you will notice for each and every record, be it registration or distribution, we are capturing the coordinate, which further can be used to gather insights from the dashboard to track all the geolocations where these activities were actually done. So what this helps is this helps to identify anomalies, suspected anomalies where the distributor, just for the sake of getting the incentives, might have been sitting in a particular location for the entire day and was trying to create false entries just to get the incentive. So these kind of activities also does happen. So with the help of these geo coordinates and timestamps for each and every transaction, we can help identify the trend and see if these are suspected anomalies, which further the supervisors can validate it on the ground. Now on the summary screen, again, I have details for review. I'll click on submit and I'll submit the details. Now, there is a further flow for SMC campaign where you need to give the remaining doses. And it again splits into two strategies. One is where you just give it on the first day and the remaining doses can be given to the mother, which needs to be given at an interval of 24 hours. Or else you can come every day and give the medicine under your observation. So here I'll say that I have not given the remaining doses, which means that I'll come again tomorrow and I'll give the remaining dose for the child. So now I'll submit. So if I go back to the household details page and if I open the child card, I can see the status has now been updated to visited. Now, if I come back tomorrow, the child status will again be marked as not visited for the next dose, and I'll again have to repeat the entire process to give the remaining medicine. So this is how the registration and delivery flow looks like in HCM. And here you can now enable the search by proximity and search the household that was registered. I can also search it based on the ID type or even the QR code that was used. So all these things can be done. I'll also quickly show you the complaint flow, how it looks like. So here, when you click on file complaint, it opens an inbox page where you can see all the complaints that are registered from your end. So I'll quickly click on file complaint and I'll file a new complaint. I'll select a complaint type. So location details is non-mandatory here as well, but we capture the coordinates if needed. And here I'll select that the complaint is being registered for myself. And I'll say that device is heating. I can put some description which will help the help desk supervisor to understand what the actual issue is and take relevant actions. And I'll click on submit. Now I've submitted the complaint, but you'll notice the complaint number has not been generated yet. Reason being that since it's an offline first application, the data needs to be synced to the server first in order to fetch the unique complaint number. Now, if I go back and here you can see on the inbox page, the complaint card has been added. Now, if I sync the data, so I can manually sync the data. And now if I go back and open the complaint, you can see the complaint number has been tagged to this particular complaint. Now this complaint number is a unique reference number that helps to track a particular complaint from both ends, the help desk supervisor as well as the frontline user. So you can share this complaint number to the help desk user so that they can identify and take actions. Now, for peer-to-peer sharing, I have a recorded video which I'll show you after I complete the other demos, other flows. So I'll quickly now re-log in. Sorry. Okay. Um, okay. Shreya, should we do the other parts as well?
Yes. I think if people have got the sense from the flow that you have already shared while PPT, the demo can be done. But quickly, we can also see, the product as is completely usable and is being used currently. But if, say, there is a different context and a different place where you want to play with it and change it, I will let's move to that, and if time permits, then
Okay.
we'll do. Yeah. Before that, there is one question that has come from Umar. It says, is the recorders, attendance, and payment features of the Digit recently added or were part of app for a while? Because I couldn't remember us using it during our LF Shisto or MR and Onco's integrated campaigns in Kano, Nigeria. So you want to answer
Okay.
that, Roshan?
Yes. So the payments module or the payments feature is something which was introduced after we had done those campaigns. In terms of attendance, we had a version where we were simply capturing the attendance from the application. But since it was just a mere capability where you were just recording the attendance without the scanning functionality, what we observed was the adoption was quite low because of its uh, capabilities, because there was no way to validate whether the attendance is being taken actually on the field or if the worker who is actually present or not. So that's the reason I think the attendance was not introduced for the countries during those implementations. But yeah, payments was not in place while we had done the LF and other campaigns in Kano back then.
How much
I
time do you anticipate will you take for the complete demo?
So what I feel is I think we can show the console first, and
Hmm.
I think that will get more questions, I would say, and Akhil can complete it, and then we can see if time permits. We can show the dashboards first, and then if the other modules are required, we can do that as well.
Sure, definitely. Okay, thanks,
Yeah.
Roshan.
Okay, so I'll hand it over to Akhil, and if there are any questions, please post it in the Q&A. I'll address it there. So over to you.
Okay, there is one question from Pawan. Pawan, if you
Pawan,
can
if you
put
can
your
put your
questions in
questions
the
in the
Q&A,
Q&A,
that will be useful.
Well, thank you very much, Roshan. Let me just start presenting. Set. Hi, everyone. I think you've heard the word configuration and configurable a lot, and this is that product which will answer your questions on what we mean by configurable or configuration. So presenting you the Digit HCM console, but first to the problem. So you saw we have a product which helps you solve your health campaign needs. We have different modules. We say we're completely configurable, but until recently, you would be dependent on a technical expert, even though our code is open source. What if you didn't know how to code? And you kept depending on your tech teams to change the product many iterations. So this really disabled the program team from quickly running campaigns. So that's when we came up with the concept of the HCM console. What if health teams could independently design and manage all the data collection forms from registration to surveys and launch a campaign within a day? So what you can do right now is you can configure the form yourself. The fields that Roshan spoke about, can you add new fields? Can you delete them? Can you add validations to them? Can you move them across? You can do all of that now. Campaigns have delivery strategies. For example, a BedNet campaign has certain conditions. A seasonal malaria chemo prevention campaign has certain conditions. A polio campaign has certain conditions. So what can you do about that? We've given you a UI to configure it. You can even upload data in the sense that, hey, I have 500 users who need to be given certain roles. Can I do that by myself? Yes. Do I want to set targets on my dashboard? Do I want to set the capacity of facilities for the stock module to work? You can set all these parameters by yourself via uploading an Excel sheet. You can even configure the boundaries as to where this campaign will happen. Campaigns are very geographic, very specific to certain regions. It's not usually done in the whole country. So you can mention which part of the country that will happen so that you collect data only from that particular boundary. Checklists are a very important part of any campaign. Can you configure your own checklists, right? So checklists change per campaign, per partner, per country. What if you have it by yourself? You can even clone campaigns. Uh, so you've done a campaign and you just feel the next campaign is a slight modification to the previous one. You can clone that, change the delta, and then start running your campaign so that you can quickly start moving on with your campaigns. So what's coming up is that we're working on even more advanced features that the console will require for an advanced user. You can use all of this to set up your campaign right now. We've decided that certain users might want even more advanced features, and that we keep releasing versions based on that. Let me quickly jump to a demo. So the reason that we even exist is, can you set up a campaign in days and not weeks? Can you not depend on any engineering teams? And as a health program team, can you have 100% control over this campaign digitization process? So I'll be taking you through a small uh, demo of sorts. So I've logged in as a campaign manager on the HCM console. Let me create a new campaign. So then I either get to start a campaign from scratch or I can even import existing campaign configurations. This is across environments. So I need to have my campaign data ready. The source of truth for this would be my micro plan, where in the campaign they decide who should be delivering what are the targets, what are the facilities, the entire plan for that particular region. You should keep your data ready so that you can quickly start your campaign. So you can see the different campaign templates that we have. So you can do a bednet campaign, you can do a polio campaign, or you can do a seasonal malaria chemo prevention campaign. I'll be choosing bednet campaign for today. I name my campaign because my name happens to be my form of versioning for different type of campaigns. I'll be calling it for the webinar HCM demo. And then I choose my campaign dates. This is the total duration on to which the campaign will last. So let's say my campaign is starting tomorrow and it ends on the 10th of December. So now I've created my draft of the webinar HCM demo campaign. So now I got to set my boundary conditions, my delivery strategy, and my app configurations, which I'll quickly do. So I'm going to choose, we have some data on Nigeria. I'm going to choose a particular province in Nigeria called Kebbi and a district. So some of these hierarchies are only from our demo environment. These do not reflect the actual hierarchies in Nigeria. So my campaign in Kebbi, the boundary looks good to me. I'm going to choose my delivery strategy. I'm going to set the distribution to happen from the distribution of bednets to happen from the 4th till the 10th. So now I set my conditions. So for example, based on the availability of bednets that have to be distributed, I choose how many individuals get a bednet. So from the plan that I have, I'm going to choose 2. So for every 2 people in a household, they should get 1 bednet. So if there were 6 people in a household, they should get 3 bednets. And also set a maximum count of 3 so that even if there are about 10 people in a household, based on the logistical constraint that I have, I'm going to only choose the maximum count of 3. And the delivery of the product is going to be bednet grade 1. I can even choose any product I want to show that, it's fully configurable. You can even add paracetamol, you can add, so for example, Milda is what's it called in Francophone countries. You can have SP, NAQ or polio for that matter. So the summary of my delivery conditions looks good to me. Now coming to the mobile app configuration. So I'm going to configure the registration and delivery modules for today. And if I'm stuck anywhere, I can always look at my tutorials and guides which are embedded onto the console. So I'm going to select some features that I want. Maybe I don't want the proximity search feature, but I like the QR code feature. So now you have a preview of the mobile screen in front of me. So let's say this is the app that Roshan was showing you. And me running my campaign, I do not want to use the word beneficiary. I want to use the word household. I can change that instantaneously. I can even add a description for someone using that, saying that please search for household head name. So you can see that description starts to come up there. Since I disabled the proximity search, it's disabled, but let's say I change my mind, I can enable it here and that will come up right here. I can even disable the QR code scanner if I don't like it. I can go to the next page. Now I can see that this is the beneficiary location page. Looks good to me, but I think I can capture more information here as the campaign manager. I'm going to call it nearest distribution point. And I think I'm going to make it a text field. So you can see that new field has now appeared. Now I can even set I can make it a mandatory field so that I make sure the people in the front line are actually capturing it. I can even set an error message in case people do not fill it. What should be the error message? I can even put input validation. For example, I think all distribution points are only letters and numbers only and no special characters. So I can set that custom regex there. I can even put a maximum length. I do not want this to cross more than 10 characters, right? So I can set that length too. And I think I can move this field, much higher up the order. So I'm going to keep it right after administrative area. So I can reorder it based on what I feel is the relevant way to do it. I can even add translations. You can see this is English first, but we do understand we operate in Lusophone and Francophone countries. So If you know what the translation for that would be, you add it here, and your app, which supports multilingual, the app will start rendering according to that particular language. So my translations are saved. I can see the rest of my fields. They look good to me. I think these are all fine. I can even remove certain details. For example, I do not want the number of members. Let that not be displayed anymore, right? Let me go on to the delivery bunch. I can see these fields are as expected. And I'm going to just submit this. So my mobile app configurations are successfully saved right now. And similarly, now I download my Excel sheet. For example, let me just show a small example. So now you have a facility template. For example, this Excel, let me just reshare my screen so that you see my Excel. So I can see these are my facilities that I already have. I can set the capacity. I can make them active or inactive. Similarly, I can add my new facilities that way. So you have complete control over what all facilities are carrying your stock. And once I'm done, I can save it and then upload this data back and then proceed to the next ones. I'll not be doing that right now due to the paucity of time. Once when I'm done, I can even configure my checklist. For example, I want to configure the checklist of a team supervisor. We have some data already there, but if you do not want this question, you can just say, do you have all necessary items to distribute? Again, these checklists reflect on the dashboard on how many people fill the checklists or not. And then I can just click configure. This is a preview of how my checklist will start looking. And I can click on configure and my checklist is created. So once I've filled all my data, including my upload data, I'll have the create campaign button that will be activated. And then I click on create campaign. Typically, we've noticed based on the boundary size, we take about 15 to 20 minutes to create the campaign itself. And once your campaign is created, you can jump to the My Campaigns flow. And then you can see in your upcoming campaigns, your campaign dates, if they're correct, and you can download the mobile application by just scanning this QR code. And the user credentials to log in from this particular button, you'll be able to download the Excel sheet and just log in. So since I did not complete my previous campaign, it's part of my drafts, my webinar HCM demo. I can always go back to my draft and start filling up and finish the campaign. So this is again to empower how eGov believes that all campaigns should be partner led. So we build tools like this so that you're not dependent on any tech intervention to start your own campaign. I leave the floor to questions right now.
Thanks, Akhil. So we have seen the demo, we have seen the admin console. So any questions from the audience? So I saw Pawan raising hand. Pawan, do you have any questions? You can ask.
Yeah, ma'am. No, right now, no question. Actually, at that time, I have.
Okay, thank you. Any questions from the audience? Anything regarding Digit HCM? Anything regarding a console that has been shared?
Shrija, I think there was a request to also show the peer-to-peer flow. So I'll just
Sure. Yes.
quickly show the recorded session for it. Yeah, I hope my screen is visible.
It's coming up. Yeah, please go ahead.
We have here is it's a recording, so you can see there are two devices which are kept adjacent to each other. So one will be the sender and the other one will be the receiver. So here you can see the sender has already downloaded the data. Just showing that how it looks like. And for the receiver, as you can see, currently there is no data in the local device. So now what they'll do is there's a share data button which you might have notice in the application for the workers. So one will click on send data, the other one will click on receive data. Process is quite simple and streamlined. So here you can see the receiver's name, and it appears on the sender's screen. And it can be a one-to-many transfer as well. So if there are like multiple who want to receive the data simultaneously, that can also be done. So if there are 5 devices, all the 5 device names will be appearing here. It's a checkbox, so you can select how many users with how many users you want to share the data at that time. And you saw the moment they selected that user, it triggered the information at the receiver end. This particular sender is trying to send some data. Do you want to receive that? So they have acknowledged the receipt. And once the sender will click on send data, it will also ask to confirm. So you can see the data is already transferred, and it will also show the boundaries for which the data is being transferred. And here you can now see that in the receiver's end as well, the beneficiary data is appearing in the local device. So this was a completely entire offline process. The entire process was done offline. Had downloaded the data while they were online from the server, and then they went on to the field and they were simply sharing this data, exchanging it among themselves in order to carry out the operations. So this was a quick demo or a quick video on how peer-to-peer sharing works. I hope the folks are able to understand how the capability works. If there are any questions, happy to answer that.
So we have already crossed our 1 hour limit, and we are past. It's already 8 minutes, but yeah, we'll keep the floor open for another 2 to 3 minutes. If you have any questions, you can add your questions to Q&A, and we'll be answering them. Okay, so if no questions, then we can close the session. What I will also share is if you have any questions and if you want to reach out and connect with us, you can share your queries. You can share, connect request at academy@egovernments.org. I'll put that on the chat box as well. And thank you, Roshan. Thank you, Akhil, for doing this fantastic presentation. And thank you, our audience, for patiently sitting with us for 1 hour. Thank you so much. We look forward to you next sessions. You can also look for our website. We have an entire webinar list published. And you can also log in to register for other webinars that is in pipeline. So there is one question: where can I download the apps?
So maybe like you can reach out to us. We can provide the access to the demo environment along with the credentials. So we have the user guides that help you understand what Digit HCM has to offer for different campaign interventions. So that contains the entire information from like how you can download, what are the login credentials and all. So yeah, you can reach out to academy@egov.org, and we can share the relevant documents and relevant resources that is needed.
And I've yeah. So go check out our webinar list and also reach out to us. I think there are 2 more questions. Okay, please, for December workshop, some country team want. Okay, we close the registration. We already have the participants that we had it for, and it's way beyond that. So there will be a lot more training sessions we will be publishing. That also you can check here. I'll just share another link where you can check the upcoming events, upcoming webinars. And you can register for that. So December webinar, I'm really sorry to say, but yeah, it's closed. Yeah, please go here and check for the events and the webinars. You can register for the another webinar that we'll be doing in February. We will share the recordings with everyone anyway. What if the HHR interchanges their devices to work? Can the system detect how many users that use that particular device? From Alucine, if I am pronouncing it correctly.
So currently, we don't track it from our systems at how many users are using a particular device. Though we have something in the pipeline for the BYOD practices as well, where we will have certain kind of validations as well, and this tracking can also be a part of it. In some countries, what we see is there are the country-owned devices where the country or the Ministry of Health procures the devices, and we have seen them using some MDM softwares. If that is applicable, if there's a provision for it, I think those MDM mobile device management tools can help monitor these information. Right now, HCM doesn't track it at the device level. We can track it at the user level and also track their location where they are operating. So we have the user tracking feature where you can track the movement of the particular user on the field. So that can be done, but that is based on the user credential, not the device that they are using.
Okay, there is one more questions from ICF Liberia. Can I suggest that some of your demo be on EIP, vaccine, and other campaigns instead of malaria?
Sure, we'll look into that. We'll definitely see that. The reason why we have it mostly in malaria space is because like we have been doing a lot of campaigns in malaria, and we are gradually evolving and tapping into other disease areas as well. Hopefully, we have something on that aspects and that fronts for upcoming sessions. But sure, input taken. Do you help with the MDM? It we don't, but we can explore if there's a need for it. We can see if we can support it in any way possible. But usually it's the country and the program who decides on that. On the admin.
Okay. So on the admin console, if I have finished setting up the campaign, configuring the app and download it, but find that I have to do some updates to a text or some boxes, would I need to download a fresh APK again, or logging out or logging in updates the already downloaded version? Yeah, Akhil.
Thanks a lot, James. So it's the same APK. Your APK does not change. The protocol would be once you change something, some configuration, you'll have to log out and log in so that the new changes reflect. You don't need to download the APK once again. So when you log out and log in, you pull the new configurations and then you see the new input there. Okay. See another question by Fazazi.
Yeah.
We're using HCM Digit for SMC campaign. So much issue synchronization. What are you doing to enhance this problem for Africa where internet is not so good? Thanks, Fazazi. I think that's a valid observation on the synchronization bit. Across campaigns, we've noticed that sync has been an issue. We've been optimizing how sync can work better with more rigorous testing. Apart from that, anything else that you would like to add, Roshan, for sync?
No, Akhil, I think yeah, like we try to also test it in real world scenarios. We procure the devices, in fact, from the countries where we try to implement for the first times, and we try to match the specs of the devices and create an environment of sorts where we can see how this will work in real world. But yeah, we are taking the feedbacks into consideration, not just aspects as well for different modules, what all can be enhanced further to improve and optimize the process. But yeah, for sync issues, like Akhil mentioned, we are doing rigorous testing to see how we can solve for it.
Any more questions? So we have the experts here. They will be able to answer. On peer-to-peer transfer, does the boundary level of the receiver restrict what he can access in case where the sender is of higher boundary level?
Yeah, so that boundary level restriction is also there. In addition to that, we also have a check to ensure that the receiver does have enough storage in order to receive the data in the first place. So there was a question that was raised in order to understand what are the device specs needed for peer-to-peer. So I think, yeah, we can share it. You can reach out to us. We can share those specs, what is needed for HCM in general. So just to highlight one more thing. So HCM is an Android application. So it works on Android only for now. So we have a defined minimum specs needed in order to run HCM. But for peer-to-peer, primarily, it's the storage that is a major part of these specs that needs to be taken care in order to use the peer-to-peer data transfer.
Thanks, Roshan. I hope, James, the question was answered. Do we have any more questions? 2 more minutes.
Yeah, Fazazi, that's again, we've revamped our stock module where you will be able to log out and log in and not re-enter the data. Yes, that is coming out end of this year. So you're not going to have duplicates. You can switch between devices, but the information does persist. That's coming up. With the upgrade, will it be possible to downsync data by health facility? Okay. Yeah, you can really change it based on health facility or community. It's based on how it's configured. We do not restrict on which level. We change it per implementation. So if that you would like to downsync data based on health facility, I think that shouldn't be a problem.
Okay, I think 20 past 4. So we are in a very good place. More questions, please reach out to us on academy@egovernments.org. Also check out our events page for our training calendar and also the webinar series. With this, I would like to close this session. Thank you so much, Akhil, and thank you so much, Roshan, for taking us through the entire end-to-end campaign management using Digit HCM. And thank you, our audience, for joining in and staying with us for 1.5 hours. Thank you so much.